I'll call in 2 minutes.
Okay. Okay. So you are dispatched to an accident involving a 10-year-old.
Okay.
That's it.
That's it. Scene safe, BSI, ALSPD, fire department, squad truck, helicopter, 2nd BLS unit. Any visible hazards?
None.
Cars running or off? Off. All right. No other injuries or another injury? All right. Oh, okay. Why did you run out? Why didn't you tell me what happened?
Somebody help him.
Come on here.
I hit him. He ran right out.
Respiration?
I don't want to get in my car.
Longer breathing 15 liters per minute.
Okay,
he ran right out in front of me.
Ceasefire maintained.
I hit him.
Go ahead
and
and
he
take
flew over there. And he landed right there.
All right.
You find blood behind the head.
Yeah,
You just do something for him.
I see no blood. I'm going to start with an RTA.
I'm with my hand. I've got
You
blood
find blood
behind the
behind
head.
the head. You find abrasions on the elbows and the
Hey, is
wrist.
it now the blood is it controlled with my hand?
It's controlled with direct pressure.
Hey,
Direct pressure. I do have ceasefire. Is he responsive to painful stimuli?
He's conscious.
Come back here.
Okay, I'm going to start with an RTA.
All right.
Ears, nose, and throats. I see nothing coming out of ears,
Yes.
nose, and mouth. Hey, buddy, can you hear me?
He can hear you.
This woman says you don't step
Pupils are
out.
closed.
Okay.
Can you also get her and make
No
sure, ma'am,
JVD, no descend jugular.
None.
Wait, put this collar on my face. All right, so we're gonna go ahead and put a C collar. We're gonna measure from the top of the shoulder to the bottom of the jaw. Yep, go ahead.
No,
Right here.
he ran right out.
I know he did, but I'm gonna find out.
Does anybody
He
know
jumped
who
on
he
the
is?
car.
His name
He
is
landed
Jared.
right there.
I know.
His name is Jared. Do we have an age on him?
He's 10.
Please.
Paradoxal movement.
Right-sided bruising on the chest.
Right side bruising.
Nowhere.
Hey, are you all right, little boy?
We do have pulses.
Hey,
Hold that. Hold
how
that.
come you ran out?
Step aside for a
How
minute.
come you ran
Step
out in front
aside.
of me?
I
You
need.
hear it?
Hey, Cromer.
Soft,
Soft.
Man, do we have a
pelvis,
police here?
tender,
Hey.
pelvis stable.
Table.
Can you have a seat?
You
You
take
can
care of him.
We
Come
are.
on.
Sure, we'll have a seat in your car. All right, we're checking.
I just hit him.
Sir,
We've got no.
if you can hear me, wiggle your toes.
You have a right-sided femur deformity.
We are. You just stay
Right
right
side femur deformity is
Deformity.
it closed?
I know
No,
you
it's closed.
Okay.
We've got.
Parents.
All right, so we're checking for
Be running
presence.
around like that.
Can you hear me? Wiggle your toes. Wiggle, wiggle, wiggle.
You can wiggle.
I see nothing
Is there
on
a
the elbows,
bystander here, anybody that can be with this
abrasions.
person?
I do have
in the car?
pulses.
Ran right out in
I
front
have
of
good
me.
pulses. They're equal. Go ahead, squeeze.
Pulses are present.
We
Squeeze.
have
Yep.
pulses.
Wiggle your toe. Wiggle your fingers.
You can wiggle this way.
Okay,
Oh,
can
we
you
have
feel
EMS
that?
and
Can you
other
talk to
large
me?
extremities.
Yes.
Does he talk to me?
Yes.
Hey, I need a 4x4 for his head, please.
Oh, dear.
And then we're gonna go ahead. I've got the chest. We're gonna go ahead and.
Hey, no, I want
As soon as we're done, we'll take this side
Yeah.
to the unaffected
Let me
side.
out of here.
We do have.
Get that rump out of here.
No,
I want
ma'am.
out.
We're gonna
You
go ahead
stay
and
right
put
there.
a bandage on his injury.
You're
and
gonna
we're
get
gonna go
tired.
ahead
You're
and
gonna
tape
get
it
mad at
down.
me, but you
Yes.
stay right there.
No, I want to go back.
No, you're not. You just stay right
Can we
there.
go ahead and get on the horn and get
Do we
police
have
out here,
anybody on
expedite
the
them?
scene?
Yes, we do.
All right, so can police detain her?
No.
They can't keep her calm.
Let me have them keys. Ain't no
Let's
keys
get a
in
fire
there.
department here. Let them detain her there.
All right.
The police
All
can't do
right, so
anything. We got fracture too, femur fracture.
Here, you gonna get tired out, lady.
Okay, we took his shirt off.
Yes.
We got him completely exposed. There was no blood found other
He
than the
shouldn't have
injury
been
found
running
on
out
the
of
road.
the road.
He is he
Where's
alert?
his parents?
He's
Where's
alert.
his parents?
We'll find him in a minute.
No.
All right, well.
Why was he running out?
All right, so we're taping his injured
Surround
side to his
anything.
unaffected side
Please.
to make sure that we
Hey, did you
stabilize
call
his
the
process.
ambulance? Did you call the
Yeah, we are
ambulance?
the ambulance.
Where are they?
Yeah, we got a calling card.
We still have good
How'd you
airway.
get here?
Yeah.
Who called you?
All right,
Okay,
so
let's
we're gonna
rotate him
call
over.
you.
Watch the elbow. You gotta
Hey,
run him over.
let me out of here.
And having any kind of Well, she
Get
ever
out of here.
Huh?
I want out.
Yeah.
Get her on there.
That way we're
Let
not
me out of here.
causing any kind of problem.
No.
So what we're gonna do is
I'm gonna go. Here I go.
All right, bye.
I'm gonna.
all right, he's still connected to
over.
15
Oh, you ain't
liters
climbing over.
non-rebreather.
Yeah, we do have that. Huh?
No, go ahead, you're fine.
Let me out. Let me out.
You gonna calm down for me?
No,
You
no.
gonna calm
Okay,
down?
ready?
Stop this.
Yeah,
horse.
On your count.
1, 2,
I hit him.
3.
He
Check
ran
his back.
right out in
Any
front of
step-offs
me.
in the neck. Check
I
his
hit
back.
him.
Make sure there's no
Anything?
constitutional
Nothing, BTLS.
Penetration, swelling, nothing was
Put
found.
him on the
Hey,
board and
Spine
move him
was
out of the way of
intact.
this
We're
woman.
gonna go ahead and roll him back on the count of 3.
She makes me
Ready?
tired.
1, 2,
Wait.
3.
I need a beer here.
Put him on the
Get
board.
out of here.
Okay,
Ready? I'm gonna
and
bring
up.
him down.
1, 2, 3.
Move up
1,
and
2,
take care of
3.
him and let me
Okay.
out.
I'm gonna take care of you first.
Sorry, buddy.
Let me out.
All right, so we'll go ahead and the blocks are right next to Cromer there on his.
No, I know that.
Okay. So we're gonna go ahead and I'm just gonna recheck his airway, make sure he's breathing on me.
Still breathing.
All right.
Will you get rid of
Bleeding
all
is still
these people?
controlled with
I
this
don't like
4x4,
people
correct?
standing here looking at me.
Well, don't look.
Be looking at
I've got
me.
C-spine maintained with my knees. I'm gonna listen to his lung sounds. Are they?
Lungs are clear.
We've got lung sounds clear
Good
bilaterally.
spiders.
Where's the police?
All right, lung sounds are clear bilaterally. All right.
Go chase her down here again.
Go, 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 go. I got
Check his
this, I got
pupils.
this, go.
Pearl. Pupils
Hey,
are
come
pearl.
on here, get out
Sir,
of the
do you know what day today is? He is warm and dry. He is alert and oriented.
He's a little pale. He's alert and oriented.
All right. All right, so we're gonna go ahead. We've splinted his leg.
Well, I got
to
two
get
very
rid-
good
get rid of all these
paramedics taking
people.
care of her. You got any problems, like medical
Yeah,
problems?
there we
you
go.
know
1,
about?
2, 3, I'll get his legs.
No, I'm fine.
If you find no history of heart or anything like that, I need to worry
yeah.
about
All right,
it.
so we have
What kind of
abrasions on his
heart?
hands, but they're not bleeding, right? They're just abrasions. There's no bleeding on his hands. We found
Well,
he's got good PMS
Well,
prior
that's
to
your fault
reporting.
if I have
No,
heart
it's
He's
not.
got a
This
broken
is right
femur,
here.
possible
police.
broken
Get the
femur.
police.
They got the
We
police
do
coming.
have a flail chest.
Hey, boy, are you okay?
We have another.
breathing?
Ma'am, are you okay?
Is he
He
breathing?
is breathing.
All
Are you
right.
okay?
Yeah, he's
We
all right.
got him. He's
He'll
under
be
control.
What's the matter with him?
He's fine.
What
He's
happened?
all breathing.
We're not
He
sure.
ran right out in front of me.
All right, where'd he
I
hit you?
hit him,
All right, so we're gonna
Put her on some
car,
O2.
All right.
and he landed right there.
Yeah.
Right
Put,
there.
Okay.
put her on some
Right there.
O2.
Yeah, ma'am, let's
Where's the
let's
ambulance?
some oxygen, okay?
Where's the
She's
ambulance?
obviously getting pretty excited.
Hey, let's put
Hey,
O2.
hey.
It's over there.
Policeman, where are you?
Ma'am,
Here, come
ma'am.
over here. Come over here.
All right, so we're gonna go ahead and continue to. There we go. Ready?
Poor little guy.
All right, sorry about that. Yeah, right now. All right, so we're gonna go ahead and tape him down to the board. He's completely immobilized. We have one person who is a little.
You gotta take care of him.
Well, I got two very good
Well,
You guys, anything else we need to know about you? Medical history
All
or
right.
anything?
no, I'm fine.
You don't have high
too
blood
low.
pressure, asthma, or
No, of
anything?
course not.
Have you eaten today?
No.
No, have you
Why
eaten
should I
today?
eat?
Can you lift
I'm
her
not
up the
hungry.
board some? Because
Okay.
this
I'm not hungry.
grass is really causing some problems. All right.
You just drive
I
and
get in
place
the
to
car
go.
and I
Alright.
just drive. You know, I like to drive.
Oh,
I'm gonna check
jeez.
your pulse if you
That's a
don't
real
mind.
nice one,
See
isn't
how
it?
your pulse is doing.
Huh?
My
That's
All right, so
what
there was
the
no
fluid
fluid
says.
leaking from the
Ears,
ears.
nose, and mouth.
No
Already
fluid
did
leaking from the
that.
mouth. All right.
Can I take your blood pressure?
We
No,
check
he-
tracheal
he
deviation.
ran right out.
No tracheal deviation.
No,
nose,
no.
raccoon eyes.
Already did that.
We got good.
Good lung
Lung
sounds.
Lung sounds are clear bilaterally.
They are
He's
clear
still
now.
breathing adequately.
You
No,
worried about
no metal alert tags. No freezing.
Okay, buddy, go ahead. Squeeze my hand. Squeeze, squeeze, squeeze. Is he squeeze?
Take care of you.
Okay, can you wiggle your hands?
Yes.
We're in the back of the ambulance. Let's call the hospital, let them know that there's a 10-year-old
Well,
right
let's get the
now.
vitals on him first.
Trying to do I was doing I did 140. I figured I'm just getting comfortable.
I have respirations of 18.
Respirations are 20.
Lung sounds are still clear bilaterally.
Clear bilaterally.
Respirations 18.
20.
20, and they're normal and adequate.
Yes.
All right, where that
All right,
stop
we've
at?
got cap refill, less than 2 seconds.
Less than 2 seconds.
He is still warm and dry.
Yep, and pale.
Inhale.
What else do you got? Let me check your lung. What kind of
But
medical
his,
history you got?
120 over 70. 120 over 70.
100 over 72.
100 over 72.
Pupils are pearl. All right, so I'm going to call med control and let him know we've got a 10-year-old male who was hit by a vehicle, moving vehicle, who has a possible flail chest. He's got abrasions on both hands. He's got a abrasion to the back of the head on the left side. A possible femur fracture. Vitals are 1. What is it?
Respirations 18, BP 100 over 72. Pulses were good,
Pulses
equal.
were present and equal in each
CNS was
extremity.
good.
He is
No-
alert
negative
and oriented. He has
JVD,
good
flail
outflow.
chest.
He's 15 on a GCS.
Yep.
Pulse ox is what, 98%?
Do I see any deformities here on the forearm, something like that?
Deformities. He's just got abrasions. Bleeding is being controlled to the back of the head.
Where's his parents?
There, we gotta find. We don't have his parents here. We'll get it soon. as we
Well,
get
why
to the
don't you
hospital.
have his parents here? Didn't you
Because-
call him?
Well, because we don't know where he lives at. You know who
Well, no, I don't know
he is?
who he
Well, how are we
is.
supposed to find him?
I'd ask him. Checked anything.
Oh.
We don't have
We're in
any
the
kind
back of the
TKO.
ambulance, right?
Yep. We have nothing else.
We're on our way. We gave an update. Let's give another update to the hospital. Let them know he's compensating. No big changes.
Give me your, let me see the vitals.
Okay.
So I'm going to call med control again, let them know we have a 10-year-old male. We're en route to their facility. We've already called once. This is an update. No other injuries noted. No other. All of our interventions so far seem to be okay.
Respirations 20.
Respirations are 20.
100 over
Blood pressure,
palpation.
100. He's still-
Pulses at 100.
He's warm and dry. He is a little bit pale now. Pulse is 100. He is still adequately perfusing. And we'll be at your facility now. No time. Time.
Time?
Time! This involved an auto accident with a female individual who hit approximately a 10-year-old boy. The female individual who was driving was hysterical, which tied up one of our crew members, while the other two of our crew worked on the 10-year-old individual. He had a flail chest, He had a femur fracture, some other bumps and abrasions. So we packaged him, put him on a backboard, and put him in the ambulance and route to the hospital. With someone who's driving around like that, or an adult who's driving, she ends up being very hysterical. You don't know what kind of behavioral responses is going to be coming from that individual. We can also see to where this might be a police problem, because this is going to be obviously a police investigation. We want to maintain her and the individual who was hit, because both of them are patients to us at the present time until we can make sure that she's okay. She might be exhibiting some other kind of abnormal behavior due to diabetic reaction or any kind of cardiac event. When there's two of us on the crew, we end up taking care of what we can, or who's the sickest at that present time, or who's going to be more of a situation that we have to maintain. We call for additional assistance, whether it's an engine company, additional ALS providers, and obviously in this situation, the police would be a vital assistance to us. You deal with the resources that you have in hand, and you take care of the patients that you have in hand that are the worst or that you can do the best for. The IRECA conference was awesome for us. We were able to compete here at International because of what we've done at Virginia State. We're able to be first place at Virginia State, and as a result, Virginia Association of Volunteer Rescue Squads sponsored Loudon Rescue to come out here for us to compete internationally. It has really helped us because it allows us to see on a very broad exposure across the country and internationally what types of people are involved in EMS and what types of techniques they're using. So it was a major learning experience for us.